Hello and welcome to the online class on hospital and its organization. Okay, let us start. The learning objectives of this online session. After completion of this lecture, you should become thorough and you should be able to define and describe about hospital, classification of hospital, different types of classification of hospital. Then we'll be trying to understand which are all the staff requirements for hospital to run successfully and efficiently. Then how hospitals are divided, that means the divisions of the hospital, and which are all the associated medical services which includes in hospital, which provides patient care. Lastly, we'll be seeing the management part, how to manage the hospital, that is called as hospital management. Now let us understand the definition of hospital, how we define the term hospital. The hospital is a complex organization and an institute which provides health to the people through complicated but specialized scientific equipments and a team of trained staff educated in the problems of modern medical science. They are all coordinated together for the common goal of restoring and maintaining good health of the people who go there for the relief from the pain, sufferings and disease. Why we go to the hospital? Because we have encountered or we have contracted with some disease or an infection, and whether there is any pain or whether there is sufferings, it may be the mental sufferings or sufferings because of trauma or an injury or any kind of disease we contract, we go to the hospital. And hospital, we can see from the definition, it is a complex institute or an organization which provides health to all people through complicated means. Here in the definition we have to understand the complication stands here because the hospital has many areas, it has having many branches in the hospital, isn't it? General medicine, obstetrics and gynecology, cardiology, nephrology, urology. There are many divisions and many systems, many different branches. They will be working under one structure with help of all scientific equipments, which are specialized scientific equipments, and a trained staff will be there. The trained staff, especially the doctor teams from different branches, who are all educated, well educated in the modern medical science. Okay, they are well educated, they are having highly qualified education in modern medical science, and later on they are skilled enough to tackle any diseases or an infection, and they come together and they work as a multidisciplinary team for giving the patient care, isn't it? So they're all coordinated together for a common goal. The goal is very common. The goal is common, that is restoring and maintaining good health, maintenance of good health of the people. So whether there is any pain, sufferings, disease, trauma, injury, there are different kinds of treatments, there are different kinds of branches available in the hospital. We'll be seeing in the later part. So the main purpose of the hospital is to give patient care, to reduce the burden of disease, to reduce the sufferings, human sufferings. Okay. So hospitals are mainly focused on providing patient care. Okay, care. Traditionally, hospitals are focused on providing care to acutely ill patients that require constant monitoring by skilled nurses, physicians, pharmacists, and doctors. Okay, so there are many different faculty members, or there are many different branches, or there are many healthcare professionals. They are working together for a common objective of providing care. Okay, so traditionally hospitals were mainly focused for treating acute ill patients. Okay, only acute ill is there, then we used to go to the hospital. Okay, for relief of from particular disease or an ailments. Okay, so these are the three pillars for any institute or an organization, hospital organization. One is the physicians, pharmacist, and nurse. Okay, they come together for the common objective of providing patient care. Okay. Another terms like clinics or consulting houses or nursing homes or family physician are used where in only doctor sits with one or two paramedical staff. It is not like multidisciplinary approach. Okay, in clinics or consulting homes or nursing homes, there will be main doctor. He'll be sitting with nurse. A group of nurses will be there, and the team doctors will be not there. Okay, that is called to be as clinics. He may be single, the practitioner, general practitioner who is involved in giving patient care, or sometimes he is also called to be as the family physician. Okay, the first point of contact. Thus, the hospital is a specialized body where the patient care is the focal point. Okay, patient care is the focal point, and about which all the activities of the hospital revolve. Means they are mainly centered to the patient care, where many activities they focus on the patient care, whether it may be doctor, nurse, or the pharmacist. The ultimate objective, the common objective is the patient care. The physician who examines and takes care of the patient is in the principal position, and the special facilities and trained personnel are provided to him to make his work easy and efficient, isn't it? Because any healthcare, if you take into account, the physician is a key person. He is the main person who is behind the diagnosis and takes the decision, medical decision. Okay, he is a decision-making authority, and apart from physician, there are trained personnel who are providing, assisting him to make his work very easy. Okay, very easy and efficient, where many number of other healthcare professions may be involved to carry out his work smooth and effectively. Trained personnel includes technical staff of nurses, pharmacists, dietitians, and apart from nurses, dietitians, and pharmacists, there are many other healthcare professions who may be involved, like a physiotherapist may be there, there may be dentist, and there are many other set of persons will be there, professionals will be there, who will be assisting the doctors. Though essentially the priority is given on the care of the patients who are bedridden and suffering from serious disease, the scope of hospital services also extend to those who may be potentially ill in their surroundings of home and town or a village. So the care is given to one and all, whether he may be bedridden. Those cases are taken into first priority. Okay, depending upon the type of the case, here the first, it is based on priority levels. The hospital in the Western countries also take upon themselves the great responsibilities for putting into operation the programs in the field of preventive medicine. They serve as a source in many areas of the population from which the professional staff and the personnel of various health agencies put their efforts and expand energies with the sole object of improving the public health. Now, let us classify the hospitals into different categories. Here we can see the classification of hospitals one by one. The hospitals are mainly classified into clinical basis of classification, ownership and control basis of classification, basis on the different system of medicine, and lastly the miscellaneous basis of classification. So mainly we are targeting on the fourth classification, that is clinical basis, ownership depending upon the type of the owner, and control basis, and based on the different system of medicine which is involved, and lastly the miscellaneous basis of classification. Now let us understand one by one different types of classification of hospital. From the organizational and administrative point of view, a hospital is virtually a city within a city. A hotel which is in the shape of patient rooms, a pharmacy, food vending operations, laundry and linen service, delivery services, a post office, a massive internal and external communication system, blood bank, accounting and credit services, a public relation department, a motor service and security patrols, which all the things which takes place in a hotel. In the similar fashion, in the similar way, the hospital operates with giving patient care. Okay, so it is virtually a city within a city. Now let us understand the clinical basis of classification. The word clinical refers to the treatment of a disease in human beings. Different types of diseases need different modes and means of treatment. So here, for different types of disease or an infection you contract, we have to give different modalities of the treatment. Broadly speaking, the hospitals may be of three types. In the clinical basis of classification, we are classifying into three types. One is the maternity hospital, where we can see obstetrics, gynecology, neonatology, surgery. One more type of classification on the basis of clinical surgery. Under surgery, we can see gynecological, orthopedic surgery, otolaryngology, logical surgery, cardiothoracic surgery, general surgery, neurological surgery, kidney hospital, urology. And in medicine, we can see general hospital, pediatric hospital, communicable disease hospital, mental hospital or psychiatric disease hospital, drug addiction rehabilitation hospital. Lastly, dental hospital. So cancer hospital is one of the hospital which comes under the medicine department. Okay, and if it is onco surgery, again it comes under the surgery hospital. So the clinical basis of classification, which includes the three types: maternity hospital. Under maternity hospital, we can see the three subheadings: obstetrics, gynecology and neonatology. And in surgery, we have the following types, that is gynecological surgery, orthopedic surgery, otolaryngological surgery, cardiothoracic surgery, general surgery, neurosurgery and urology, urosurgery and the oncology, oncosurgery. Medicine, general hospital, pediatric hospital, communicable disease hospital, mental or psychiatric disease hospital, drug addiction rehabilitation hospital, dental hospital and cancer hospital. Sometimes what happens, the cancer hospital is made separate, okay? They have separate division and sometimes it is not included in the surgery. So now we will see and we will try to understand one by one about the maternity and different kinds of services which are given in case of the maternity hospital. Under maternity hospital, we have seen the three types, and coming to the obstetrics, which is specialized to provide obstetrics, the dealing with childbirth is called to be as obstetrics. And gynecological related to the female reproductive system and the female reproductive system diseases, okay, services along with antenatal during pregnancy, which comes under the category of gynecological services. Both obstetrics and gynecology will be performed by obstetrician and gynecologist. They are called to be as OBG. And the one more services which is coming under the category of maternity, that is neonatology, which means neo means new, so newborn child care. So neonatology, which includes the care of newborn child. Nextly, you will see the surgery hospitals. Surgery hospitals are those which is specialized to perform the surgical operations. In other words, they have operation theaters and surgeons are there for doing operation. There are different types of surgical hospitals, such as what I have mentioned, gynecological, which is related to the female reproductive system, which I have told now. This is usually attached with maternity hospital. And one more thing, that is orthopedic surgery related to the bone and bone fractures. Otolaryngological, that is related to the ear, nose and throat surgery. Cardiothoracic, related to the surgery of heart and lungs. These days, open heart surgery, that is open heart surgery, coronary artery bypass graft, or angiography and angioplasty are very common in these type of hospitals. So we can see here, which is specialized to perform surgical operations, a set of doctors. In other words, they have operation theaters and surgeons. Gynecological, related to the female reproductive system. This is usually attached with maternity hospital. Orthopedic, related to the bone and bone fractures, orthopedic surgery. Otolaryngological, related to the ear, nose and throat surgery. Cardiothoracic surgery, related to the surgery of heart and lungs. And we can see the coronary artery bypass graft or angioplasty procedure, where we can see in this diagrammatic illustration. Angioplasty, again, a very common type nowadays. Many people, they are having stents. In this type of hospital, they perform cardiothoracic as well as angioplasty surgical operation. I mean, a modern advanced technique. Just without open heart surgery, they are doing angioplasty. Okay. Now, we can see the general surgery, a surgery of any kind, neurological surgery, having facilities for surgery of brain and spinal cord. And kidney hospital, this type of hospital is involved in kidney transplantation and blood or peritoneal dialysis services, where kidney is not functioning properly, so they may put on dialysis. Coming to the medicine, we have following categories. One is general hospital, where what is called as family physician treats or advise the patients for disease related to any type of infections or any ailments. Secondly, under medicine pediatrics hospital, where special care for children is taken. Communicable disease hospital, this is a type of hospital that should have adequate space to prevent spread of infectious disease and takes care of patients with such disease. Mental hospital or psychiatric diseases hospital. This is a specialized type of hospital which has facilities to treat and rehabilitate the patients with mental disease. And they have a department called as de-addiction, drug addiction rehabilitation, or de-addiction centers, which attempts to make the patients de-addicted from the different kinds of drug abusers who are from narcotics or tobacco chewing, how to cessate the tobacco chewing, narcotics, drugs, or it may be the common form of tobacco or smoking. And dental hospitals where they give the care for pertaining to the disease of the teeth, disorders of the teeth. These are general purpose hospitals that provide treatment other than the mentioned above. Okay. There cannot be a margin between a type of treatment to be provided. A physician can advise about treatment with drugs and a surgeon can perform surgery if required. In the world of specialization, there can be different types of hospital providing specialized care for a particular type of disease. So what we are speaking now, firstly, a patient can directly go to the primary healthcare provider, where we'll be seeing in detail in coming slides. And sometimes when he goes to the physician, and physician may advise a surgery is required, and he may be sent to the surgeon as a referral and for operating some kind of surgery. Other types of hospital where we can see, that is the cancer hospital. Okay, in this type of hospital, surgical treatment is quite often given. They give the surgery treatment followed by radiology, radiotherapy, followed by the chemotherapy. Skin and venereal disease hospital. There may be different classes of hospital called as skin and venereal diseases pertaining to the skin and the sexually transmitted diseases. They are called to be as venereal disease hospital, whether it may be herpes simplex or syphilis, gonorrhea, chancroid, any other types of diseases which is contracted during sexual intercourse. Kidney hospital. Any type of kidney infection to the kidney or the problem infiltration or accumulation of the substances, waste substances, then a kidney may be kidney failure, acute renal failure, or any type of such conditions, then he may be referred to the specialty, that is kidney hospital. Eye hospital, any problem with the eye, that is ophthalmology. Family planning hospital, where family planning is required, whether it may be the tubectomy or vasectomy or any implantation of any family planning devices. Okay, so a family planning hospital is referred in such cases. And cosmetic surgery hospital, in case of any cosmetics or something has to be made change, so a cosmetic surgeon may be there for helping these kind of things. And lastly, to control diabetes and the obesity, which has become a menace to the society, where obesity and diabetician, or I should say the endocrinologist, will be there for for treating such kind of disorders. Now coming to the ownership and control basis of classification, what we have seen till now is based on the clinical basis of classification, isn't it? We have seen the clinical basis of classification, and we have seen the three headings, that is maternity hospital, surgery hospital, and medicine. Now we'll be seeing the ownership and control basis of classification, the second types of classification, what we are seeing now. According to the ownership and administrative control, hospital may be classified into two types. One is the government hospital and other one is non-government hospital. In the government hospital, we can see the public health service centers or civil hospitals. Okay, the public health hospitals or civil hospitals, public health service centers or civil hospitals, which includes All India Institute of Medical Sciences, AIIMS, which is in New Delhi, or Post-Graduation Institute of Medical Education and Research, Chandigarh, Pondicherry, and some of the government hospitals may be located. Okay, all these hospitals may be associated with teaching institutions like medical college. And secondly, under government hospitals, we can see the military hospitals. Okay, the name itself is self-explanatory, where military hospitals are those hospitals where they give patient care for the army persons, whether they belong to Army, Air Force or Navy. Any three kind of services which has been rendered to the society. So these hospitals are called to be as military hospitals. They are coming under the category of government hospitals. Okay. Second, under ownership and control basis of classification, we can see the non-government hospitals. Okay, non-government hospitals which are not from government. They may include private hospitals which has been privately run by the owners, whether they may belong to Apollo Hospital, okay, Escort Hospital, Sterling Hospital, Fortis Hospital, and Jaydeva Hospital, whatever it may belong, they may be running by the private body. Okay. And other type of classification which includes charitable trust hospitals, which is run by the trustees who are the charity for charity. For example, which includes Ramakrishna Mission Hospital at Kolkata, Christian Missionary Hospital at Vellore, Malji Bhai Hospital, Nadiad. Okay, they are all the charitable hospital. Like a charity, they run hospital and they give services to the patients. And the third type of classification, which includes the system of medicine basis of classification. The classification is based on different types of systems of medicine which is involved. In India, apart from allopathic system of medicine, other system of medicine are practiced. Okay, such as Ayurvedic hospital, Yoga and Naturopathy hospital, Unani hospital, Siddha hospital, and Homeopathy hospital. Okay, different types of alternative system of medicine which is practicing and giving services to the mankind. These hospitals may be again subclassified according to the clinical basis and ownership and administrative control basis of classification, as I have told or as I have mentioned above. So, how to remember this Ayurvedic hospital, Yoga and Naturopathy, Unani, Siddha, Homeopathy, where they are called to be as alternative system of medicine. Easily we can remember that is Ayush. Okay, Ayush board, that is A for Ayurveda, Y for Yoga and Naturopathy, U for Unani system of medicine, S for Siddha system of medicine, and H for Homeopathy. In many respects, the organizational patterns of hospital resembles very much with that of an industrial plant, and the apparent difference is superficial. For example, in a commercial entity, there may be a general manager or the executive, vice president. In hospital, there is a director or superintendent. Both are governed by either corporation or board of trustees. I will be showing you the figure which represents the organizational chart of your hospital. The number of administrative personnel, however, depends upon the size of the hospital, whether it is a multitask hospital, with tertiary care teaching hospital, and how many type of services which is given, because it is multi-tertiary care hospital, they'll be having different categories of treatment available. So there will be different kinds of services which has been told earlier, whether it may be urology, nephrology, or whether it may be gynecology, obstetricology, whatever it may be. Lastly, the miscellaneous basis of classification. The miscellaneous basis of classification, the hospitals may also be classified as accredited or non-accredited hospital based on whether they have accreditation from competent authority or not. Okay. This system exists in USA and some countries, developed countries, but this is not practiced in India. Another method of classification of hospital is on the basis of the bed capacity. whether it may be 50-bed hospital, 100-bed hospital, etc. Now I'll be showing you the hospitals based on accreditation. Hospitals are classified into two types, which I told now. Accreditation, where accreditation means they'll be accredited from the NABH. NABH stands for National Association Board of Hospitals. They give accreditation for the hospitals which is of international standards. The hospital is accredited with NABH means it is having the international standards. And non-accredited hospitals, they don't have any accreditation. Other type of classifications which I told, hospitals can also be classified based on the capacity of the beds, number of beds involved in treating the patients, whether it is 50-bedded hospital, 100-bedded hospital, or the 1,000-bedded hospital, or more than that. Hospitals can also be classified based on primary, secondary, tertiary, and quaternary care. Okay. Now we shall understand how the classification based on primary, secondary, tertiary, and quaternary care. Each level is related to the complexity of the medical cases being treated as well as the skills and specialties of the providers. Okay. Coming to the primary care, which is the first point of contact for many of us, where the primary care healthcare providers may include doctors, nurse practitioners, pediatricians, obstetrics and gynecology, where they are primary healthcare providers are the first point of contact for many of us. So directly we go to the primary healthcare providers. Secondary care is little bit of advanced. When the primary care, when these doctors, primary care provider, when it is not possible to treat the patient, some advanced technology is required over there, or some specialist is required in treating diseases. So these primary care provider or the primary care practitioner, they will refer to the secondary care hospital who may be a specialist in particular disease or in particular ailment. And tertiary care and hospitalization is required when the patient has to meet two or more specialities. When he has to meet, suppose if you want to tell me the example, he has encountered two things. He may be having diabetes and he may be having hypertension. He may be having one more existing condition. So kidney is not working properly. So he has to meet nephrology or urologist. A surgeon, sometimes a kidney surgery is required. Urologist will be seeing over there. And some other problem is there, that is diabetes. Endocrinologist will be there. He will be assisting. And sometimes he has to meet the cardiothoracic surgeons or cardiologist. Okay, so there is a highly specialized and expertise team will be there to handle any type of problems which is pertaining to. And quaternary care, which is the extension of the tertiary care, okay, where super specialty doctors will come into picturization here. Some care which is given for advanced level, whether it is the cancer, oncosurgeon, or the pediatric surgeon, where it is referred to the quaternary care hospitals, where it is a extension of the tertiary care, where many group of people, many group of super specialty persons, qualified persons, they'll be coming under one roof and they'll be working for common goal, that is patient care. Now let us understand administrative organization pattern in a hospital. How the administrative pattern, the organization pattern runs in a hospital. Coming to the government or corporation, there will be, under him, there will be governing council or the board of trustees. And under him, there will be a director or superintendent, medical superintendent. Again, it may be run by the personnel or it may be run by administrative assistant below superintendent. Again, there may be executive committee of staff for execution of the work, or there may be a public relationship officers. They are called to be as PROs. So it is mainly classified into 4 categories. I'll be showing you one by one. There may be a presence of associate director or head clinical services, and under associate director or head clinical services there may be a medicine, there may be a surgery, there may be a radiology, there may be a pathology, clinical laboratory, blood bank, research laboratory. Under different division, that is under associate director, head specialized services, there may be a nursing services, dietary services, physiotherapy services, where physiotherapy is taking care of some after surgery, after orthopedic surgery, the physiotherapist will come into picturization over there, and he'll be telling you some examples for the rehabilitation. Medico-social and medico-legal services, and lastly the central sterile services. These are all coming under the category of associate director or head specialized services. This is clinical services and this is the specialized services. Next is associate director or head the pharmacy services, where there will be manufacturing unit, drug purchase and drug distribution, drug information services, therapeutic drug monitoring services, medical record keeping services. They have to keep the records, they have to documentation, they have to do the documentation work, they have to keep all the records which is available. And last type of classification, which includes associate director or head administrative services, where the grants and the contracts, credit services, telephone services, housekeeping, laundry, etc. So the grants and the contracts, some grants will be given, or some services, whether it may be Yashaswini services or whatever the services, these administrative services will be taking care of all those things. Okay, whether it may be housekeeping or laundry. Now, let us understand one by one the different types of services of different people. Firstly, the administrative staff. The hospital in general is managed by the Board of Trustees or the Governing Council appointed by the government or corporation. They delegate the active management of hospital to the administrator along with his staff or associates. There will be assistants, supervisors and department heads. The main function of the administrator is to enforce trust policy in daily routine. In addition, he plans an active role in community public relations as well as liaison between the medical staff and board of trustees. So, any hospital, they'll be having administrators. They are called to be as hospital administrator. He will be conducting, he will be implementing certain policies or certain guidelines. Okay, all the guidelines which is framing the hospital administrator or such eminent person, where all the persons will be, he carries out whether all the things are going in a smooth and effective manner or not. Okay, so he is a person who is working in coordination with all the staff. The main function of the administrator in nutshell is to enforce the policies, is to lay down the policies. Okay, he is to implement the policies. What the policies he has enforced, he has to implement it, and he will laid down by the board of trustees or the governing body for day-to-day working of the hospital. What all the things which has been told by the board of trustees or the governing body, he will enforce all those things and he will work day-to-day all the smooth functioning of the work in a hospital. He operates the entire institution such that highest possible standards of both services and economy are assured to the medical and scientific staff, the trustees and the patients. So entire institution, he will carry out in highest standards possible, which includes highest patient care, and within the limited economic settings, he will take care of all the things, whether it may be staff, trustees and the patient. In addition to this, he must plan an active role in community, public relations, as well as liaison between medical staff and board of trustees or the governing body, as the case may be. So he provides liaison means the coordination. He is a link between medical staff and different categories, whether it may be the governing body, board of trustees, nursing staff, pharmacist. So he is providing active role in community public relations. He may be providing a link between all the staff, whether it may be PRO, public relationship officer, whether it may be a medical staff, whether it may be a board of trustees, whether it may be a governing body, or whether it may be a medical superintendent. Day to day, he is reporting all the activities to medical superintendent or higher authorities, and he will be working in coordination with all the medical teams. Now, coming to the medical staff. Every hospital must have medical staff responsible for all medical care to be provided to the patients as per the ethical conduct and professional practices of their membership. The framework of medical staff varies from hospital to hospital. However, in big hospitals, staff may be divided into residential medical staff, associate medical staff, consulting medical staff, and honorary medical staff. Honorary medical staff, see, many hospitals they'll be having medical resident, okay, and this senior medical resident who is guiding, and there may be associate medical staff for associate things in coordination with the medical staff, main medical staff. There may be a consulting medical staff, and there may be a honorary medical staff. We will see all these things one by one. Coming to the residential medical staff. The residential medical staff is available on 24-hour services basis and is available around the clock to attend the patients. So he is the person who is available for 24 hours. They are also involved in organizational and administrative duties pertaining to the medical staff. The associate medical staff are the practitioners appointed and assigned to various services in the same manner as members of active medical staff. They may be advanced to as the residential medical staff. Okay, the residential medical staff is the one, as I told you, who is available for 24-hour service. Okay, and under him there may be associate medical staff and other practitioners, and they may be assigned and they may be working together. Okay, they are members of active medical staff. Okay, so coming to the consulting medical staff. Consulting medical staff consists of medical practitioners of recognized professional ability and are not members of the other proceedings categories of the medical staff. So consulting medical staff, sometimes they may consult based on the request. Okay, they may become a special consultants. Okay, it depends upon the requirements actually. The honorary medical staff is like a part-time consulting medical staff. The honorary medical staff is like a part-time consulting medical staff, as I told you, and they don't be regularly coming to the colleges, I mean the medical hospitals, but they'll be coming based on the call, I mean the consulting, special consulting hours, or because they belong to the category of retired, they're already retired from the service, and they may be emeritus physicians or those kind of practitioners who have their own clinic, but they want to provide the services which are said to be as honorary services to the hospital. Okay, the above mentioned medical staff may be further subdivided into staff of different clinical divisions based on the degree of their specialization. Okay. Now we can see the sum of the divisions are as follows. What I'm covering is the divisions of the hospital, where the medicines are mainly categorized into 13 specialties under medicine. Okay, we'll see one by one what it is. Yeah, firstly, we can see here the internal medicine here. The internal medicine doctor who is well versed in the all kind of the diseases, whether it may be the lungs, the kidneys or bone and brain, heart and the GI system. He is the first point of contact for most of the patients. Secondly, the cardiology division, one who is expert in treating heart and heart related disorders. Then gastroenterology, one who is expert in the treating GI disorders. Nephrology, kidney. Pulmonary diseases, chest physicians. Psychiatry, they are called as neurologist or psychiatric doctors. Infectious disease, allergy, skin and venereal disease. Endocrinology, one is treating the endocrine disorders like pituitary gland or the adrenal glands or some kind of diabetes and the thyroid disorders. Now we can see the geriatrics population whose age is more than 65. Elderly patient there. It has been steady increase in the number of elderly patients nowadays. Okay, so it is very great things that they have to take care. We have to take care of geriatric population. And immunology, again the study of immune disorders. Okay, whether it may be the psoriasis or any kind of autoimmune disorders. And lastly, it is the pediatrics, a branch of medicine which is dealing with child and child-related disorders. Okay. Now coming to the surgery division. Now we will look at the surgery division. There are different kinds of division in the surgery where we have seen the divisions in medicine. Now we will try to understand the various divisions in the surgery. Okay. There are general surgery division. There is a obstetrics and gynecology. The general surgeons are mainly dealing with the surgical, the surgery operations like hernia, appendicitis, or appendectomy, or a kind of the fistula, piles, and other kind of operations. Whereas the obstetrics and gynecology are the experts in women and women-related health, whether it may be the delivery and other kind of things. Okay, and nextly the orthopedic surgery, the bone, joints, and other kind of surgeries, and ophthalmology, where the study of eyes and eye-related disorders. Otolaryngology, we are well known that it has been told to you that they are dealing with ENT, dental and oral surgery, and sometimes in case of accidents, these dental surgeons or the oral maxillofacial surgeons will be coming into the role. Nephrology is a kind of the division which is coming under the surgery. They mainly involved in the treating the kidney and other related disorders. They do surgery. Okay, it is called as urology. Okay, and nextly we move on to other kind of things which are there. Neurological surgeries, where the brain operations are carried out by these surgeons, neurosurgeons. They're called to be as neurosurgeons. And cardiothoracic surgery, they do operations like bypass operations or CABG, coronary artery bypass graft, and other open heart surgery. Plastic surgeons, or they are mainly involved in doing the plastic surgery and for increasing the cosmetic beauty or some kind of things which is required in case of some damage or some modifying the structure of the organs. And lastly, we can see the anesthetic service, which is given by the anesthesiologist, and they are experts in handling the anesthesia and prior to the operation, they will be handling the anesthetics, the teams or the doctors will be handling all these kind of things where it is a major thing. All the hospitals should have anesthesia experts. Now we shall try to understand the associated medical services in the hospital. Okay. In addition to the medical staff involved in diagnosis and treatment of the disease, there are some other medical services wherein medical staff is the chief and help main medical staff for the diagnostic and treatment. These associated medical staff are very important in diagnosing the disease, the treatment of the which disease it is, which organism. So we will see what is associated medical services. The pathology and clinical services, clinical biochemistry services, radiology. This is one of the most important service. We shall try to understand in coming slides what it is. Blood bank, how the blood bank is useful. Medical social service department, what it is. And lastly, what is anesthesia services and their role in the hospital. Okay, we shall understand in a detailed view. Firstly, the pathology and the clinical biochemistry services. This is an important supportive services wherein medical tests for various samples like blood specimen samples, urine specimens, sputums, feces, etc. They check the presence of the pathogenic infection, the root cause for the infection, which type of bacteria, which type of viruses, which type of the organism is involved in manifestation of the disease, in causing the disease. They check the abnormal parameters in all the specimens, whether it may be the sugar, whether I should not say sugar, it is the blood glucose level, urea level, or some kind of abnormalities in the lab value. And they give instructions to the physicians with written statement. These are the abnormalities which has been noted, and they send back that lab data or the pathology or clinical biochemistry data to the physician and surgeon. These are handed by the head of the services, like mainly he will be MD pathology doctor or MD the clinical biochemistry doctor, who is a medical person, highly qualified person who is having expertise or specialization in particular fields. Next one is radiology. This is one of the most important service. So radiology is a branch of medicine which deals with the diagnostic and therapeutic application of radiant energy, chiefly in the form of X-rays and other rays like radium. Okay. Generally, the department is headed by MD radiologist, MD radiology. These services are performed only on the receipt of written order by a medical staff. They don't do radiology, or they don't check the X-rays and other CT scans or other things without the written consent from the doctor. The therapeutic use of radium and other radioactive isotopes in the hospital is limited to the physicians only, because irrational use or some kind of unwanted use of radium therapies or some kind of the radium rays is very, very dangerous. Okay, it can cause a serious consequences in the patients. So this has been permitted with consultation by the physician and the recommendation of the physicians. These radiologists work, and they have to take almost all precaution, and they should always follow the guidelines of radiation safety committee methods. Okay, now we will see the radiation safety committee and how the radiologist will implement that thing. Only suitable trained and experienced persons are allowed to handle the radioactive substances. Because of this, very dangerous substances which can, when it is exposed to radiation therapy, it can cause the unwanted effects. Okay, the cancer and other things. This department generally consists of physicians who are well trained as a radiologist, physicists, technicians, radiotherapists, isotope pharmacists. Isotope pharmacists in USA, they are performing. In India also, there are pharmacists who are experts in handling radium therapies in the hospital. Okay, one of the specialized branch in the radioactive isotopes. They are usually the pharmacology, and after pharmacology, they may enter as a radiation experts. Nurse, assistants, and secretarial persons will be there who is assisting the radiologist. So you might have heard about the sonography, the computer-aided tomography, CAT scan, PET scan, positron emission test, magnetic resonance imaging, MRI scan. Okay. Now coming to the next, the thing that is the blood. Blood bank, this is another important service which collects the process and supplies blood and its products whenever it is required, like blood, plasma, and platelets. In case of some accidents, in case of needy persons who are required the transfusion of the blood. Number of blood banks are run as a main activity of some of the private bodies like Red Cross Society and such other voluntary bodies. Okay, so we have to understand this is one of the life-saving methods. Nextly, we shall discuss about the Medical Social Service Department. This department provides an important liaison between the hospital and the patient and his relative. They are mainly the social work departments like MSW, who is having graduation of Master of Social Work Department, and they are having the coordination. They work with coordination with patient and the staff. And these qualified social worker, they represents like a discipline whose professional focus is on social aspects of patient and his family. They tell mainly they provide information to the patients regarding about the risks and benefits, and they relate it to the medical or surgical treatments. What are the risks they associated and what are the benefits which are associated. Lastly, we will see the Anaesthesia Services. The last, which is very important service, which is given by the specialized team, that is anesthesiologist. They'll be working with other team doctors, whether it may be nurse or some other kind of anesthesia teams. They are highly qualified doctors, one who is qualified like MD anesthesia. Okay. These anesthesia service, generally it will be handled by the anesthesia expert, who is a doctor and is responsible for proper administration of anesthetics. The anesthesia expert is also, the doctor is also responsible for following all of the following things, whether it may be the quality of anesthesia care rendered by the anesthetist in the surgical and obstetrical areas prior to the surgery, availability of the equipment necessary for administering anesthesia and for related efforts for resuscitation, development of regulations concerning anesthesia safety, evaluation of anesthetic care retrospectively. Next, we shall move on to the supportive paramedical services and the staff. Okay, we have seen now the associated medical services. Now, which are the supportive bodies, which is very important for the sake of the patient care to run effectively and smoothly. A hospital does not have only the clinical departments, okay, but also a number of supportive services such as nursing department, dietary services, and other services are very well required. Okay, whether it may be the laboratory services, medical records department, blood bank, and the central sterile pharmaceutical services and social services. The revolution in medical care has its effects on the other health professions. For instance, keeping pace with medicine has meant many changes in the practice. So, the medicine is ever-changing science. The nursing team, made up of workers with varying degrees of skill in nursing and directed by a professional nurse, now replaces the single nurse who did everything for the patient. Now, in the nursing also, there are many specialty programs are there. Okay, nursing is having almost more than 10 specialty programs. Okay, cardiac nursing, geriatric care nursing, pediatric care nursing, onco nursing, surgical nursing, medical social nursing, preventive and cardiology. Preventative nursing, palliative care nursing. Okay, so there are many specialties existing in the nursing department also. Today's practicing nurse recognizes not only the social, psychological, or the religious problems with a patient that might influence his physical well-being, but also refers to those that lie outside the province of the nursing to the person who is the most competent to deal with the help or to help them. So she understands the psychological problems of the patient. She gives care to the patient. She's having the quality of empathy, compassionate, care. The following are the basic assumptions regarding the nursing care, which one could make about for the better health care. The purpose of any healthcare profession, whether it may be doctor, whether it may be the pharmacist or nurse, the purpose is same, that is better patient outcome. Okay. Now we are concentrating on the care which has been given by the nurse. These were initiated by the National League of Nursing in the USA in 1964. Nursing care encompasses health promotion, the care and the prevention of disease or disability, rehabilitation, teaching and counseling and emotional support, as well as the cure of illness. Nursing care is an integral part of total health care and is planned and executed in combination with related medical, educational, and welfare services. Nursing personnel should respect individuality, dignity, and rights of every person, regardless of race, color, breed, national origin, social, and economic status. The nursing department functions under the head of nursing. So there will be a head nurse. Under her, all the nursing staff will be working accordingly. She may also be the head of the school of nursing, which may be an added responsibility to her. Now we can see some of the other supportive paramedical services and staff, which may include the dietary services. This service functions under the nutrition department. This service is organized in such a way that it will effectively apply the principles of science of nutrition to prepare a palatable and appropriate food to the patient. The services are usually in the charge of a qualified dietitian, okay, and some of the other staff may be supporting to her. In addition to the purchasing, planning, and preparation of menus, both for patients and for employees, the dietitian he is responsible for taking the histories of the patient, especially who is having the food allergy. And these dietitians, what they do, they provide a diet plan to patients, and they ascertain the patients, they interview the patients, and they will collect all the relevant information regarding about their diet and the food they take, and they give a planned diet for particular kind of disease. There is a separate diet for the cardiovascular disease like heart failure. There is a separate diet for the patient who is having the kidney problem. There is a diet maybe separate for a patient who is having the diabetes problem. There is a unique diet for the patient who is having the obesity and other disorders. So these dietitians' role is a great task. They help which diet is required for which type of patients. Okay, they counsel the patients and their family members. They modify their pattern of the food. So they act like the team members, and they modify the meal systems. Okay, so they may be actively involved in ward-round participations and other conferences for nutrition and other aspects of the things, which becomes very, very important because the food is a medicine. Food itself is a medicine. Coming to the medical record services, okay, in a hospital, it is required to maintain adequate medical records at all times. So proper documentation is really necessary at all times. So they must be accurately documented, readily accessible, and should be easily used for retrieving or compiling information. The purposes for which medical records are required to be maintained are, now we'll be seeing why the record maintenance is required, why they have to maintain the records. Okay, to serve as a basis for planning and for continuity of the patient care. Each patient will be having specific ID number, unique ID number that will be kept like a retrieval of information of the patient. Okay, for giving care, to provide means of communication among the physicians and any other professionals who can contribute to the patient care. Okay, it's like a communication means. To furnish documentary evidence for the course of the patient illness. So all the things which has happened, suppose the patient is suffering from diabetes, all the document has been documented in the record so that this is the evidence-based information, evidence-based data, and what the treatment has been initiated from the patient. What was the course of the duration of the length of the hospital stay of the patient? What the treatment he was getting in the hospital? When he has been discharged from the hospital? Okay, each and every data is in the documentation. He is in the file of the patient. Okay, he is in the record of the patient. So to serve as a basis for review, study, and judging the care rendered to the patient, to assist in protecting the legal interest of the patient, hospital, and practitioner who carries a great responsibility. To provide data for use in research and education. Sometimes many studies will be conducted, retrospective studies, back in time. Okay, for those people, for researchers, it becomes like a valuable task for them. They get all the data pertaining to the diabetes, pertaining to the kidney disorders, pertaining to the any kind of diseases. They can study it. Okay, so retrospective studies can be carried out in the hospital. A retrospective type of analysis can be carried out in the hospital by using medical records. Okay, a full and detailed medical record is one which includes identification, sociological data, personal family history, history of present illness, physical examination, special examinations such as consultations, clinical laboratory data, X-ray, etc. and etc. Okay, it can also include provisional or working diagnosis, medical or surgical treatment which he has taken, drugs prescription, gross and microscopical pathological findings. Whether the progress is there, they'll be adding the progress notes. Final diagnosis, okay, the provisional diagnosis as well as final diagnosis, the conditions of the discharge, any other against the medical advice, follow-up, and what are the autopsy findings. So the medical record should contain all the detailed information to enable another practitioner to assume the care of the patient at any time to give effective and the continuing care to the patient, isn't it? So that it becomes the valuable documentation for other doctor or practitioner what the decision he can take based on the available existing data. Okay. Medical record consists of following parts. We will be seeing the following parts of the medical records. Okay, different parts of the medical records we'll be seeing. One, the data for identity of the patient and admission, chart or sheet. It generally contains the information like the name of the patient, unit services of the hospital to which he has been referred, record number, address of the patient, telephone number, sex, date of birth, place of birth, whether married or single, occupation, referring doctor's name and address, from which doctor refers him, his name and address, diagnosis has been made, which diagnosis, date and time of admission, and location within the hospital. So which ward he was staying, in which ward he has been kept. Okay, all these informations, relevant informations about which reveals the data to identify the patient. This is called as admission chart or sheet. Okay. The sheet may also contain other things like consent forms for the authorization for the release of the information to other physicians. Some information may be the private information, so the consent forms are required. Okay. The admission history sheet usually provides space for recording the names of the person furnishing information as well as the name of the individual history taking. Okay. The purpose of history at the time of admission to record the patient's chief complaint and a description of presenting illness. Okay, what the illness he is having, for what he got admitted to the hospital. In addition to, it provides the opportunity of furnishing of provisional or admitting diagnosis, which is usually made on every patient at the time of admission. He got admitted and what he has been diagnosed. Okay, the provisional diagnosis. There is one more important medical record services which comes into picturization in the hospital, that is clinical history sheet. This clinical history sheet, it provides the information of the past hospital admission with their subsequent diagnosis, operations and major injuries that have been experienced by the patient in the past times. Okay, it can give all the relevant information about the past incidents which has been taken place in the patient. The history of childhood and adult infectious disease, okay, pregnancies with details about the dates, results, and complications. Any pregnancy complications in case of the complications of pregnancies. Current medications, what he's taking now. Immunization data, especially which happens in the pediatric patients. History of transfusions and reactions. Transfusion reactions has been developed by the patient, with dates, reactions, and other complications, if any. Pertinent sociological data covering the habits and other things which may include all types of habits, including alcohol, smoking, tobacco chewing. The diet, height, weight, and other the things which are the demographic details, or even the birth or country of birth, education status, occupational status. Okay. And lastly, the status about the marriage, health of the family history. Okay. So many diseases can be revealed by taking the family history because they are genetically predisposed to that kind of illness. Okay. The next one would be the physical examination sheet. So whenever the physical examination sheet, it records information about routine systematic review of the many things like skin, head and neck, cardiorespiratory, breast, gastrointestinal, urinary, genitalia, endocrine disorders, metabolic state, lymph nodes, and hematological and musculoskeletal extremities, urological, psychiatry, and allergy. This data is received by the physician before he proceeds to the line of treatment to be followed during the patient's stay in the hospital. So he collects the physical examination sheet will collect overall status of the patient, how he is actually. Some problem in the head and neck, some problem may be in the breast tenderness. What may be the reason? Some problem in the GI upset. There is a GI upset in the patient. What may be the problem? Then what test has to be ordered, advised to the further investigation? So the physical examination sheet will reveal many things. This has to be kept as a record maintenance by the medical social service, medical record services. Nextly, we'll move up to the follow-up and the medical treatment sheet. Okay. Before that, there is one more thing which is very, very important, which tells about the laboratory parameters. I think that slide is missing here. The laboratory parameters are very, very important. Okay. The laboratory parameters which use the chemistry, the laboratory results, maybe about blood chemistry, hematology, microbiology, serology, pathology, as well as all the radiology departments. From all departments, the laboratory sheets has to be maintained properly. Okay. Lastly, the follow-up Last but one, the follow-up and medical treatment sheet. Okay, the follow-up sheet and medical treatment sheet will be maintained, which should be maintained correctly. All the things has to be maintained correctly. All the procedures for the treatment carried out on the patient are recorded with medical record. Operative notes are also included in the record and should contain both the description of the findings as well as the detailed account of the technique used and the tissue removed if in case of surgery. Progress notes are made in this sheet of medical record for the purpose of providing the physician with a chronological picture and analysis of clinical course of the patient. Okay. Lastly, the discharge summary sheet, which is meant for discharging the patient and his summary during discharge. What the summary they have gathered from the patient. Upon discharge from the hospital, the patient's record is entered into the discharge summary note. Okay. The purpose of this is to provide recapitulation of patient's hospitalization. Some hospitals do, however, send a copy of this discharge summary with the patient. Okay, we do that in our hospital. Whenever he is transferred either to another hospital or to an extended care facility or a nursing home, this will be very, very valuable information. So that each and every treatment plan, the duration of course, and what disease he is having, the whole summary will be written into the discharge summary sheet. So that patients will be carrying on any kind of adverse reactions have been notified in the hospital. It will be written there. Okay. Some of the items included in the discharge summary include, now we shall see which are the things which includes in the discharge summary sheet. Brief history, results of physical examination, laboratory data, description of the patient's hospital course, diagnosis of the present condition, medications that have been sent with the patient, a list of operations performed, any other complications notified, condition and estimated length of disability which may be expected. Lastly, if the patient dies while in the hospital and an autopsy has been performed, the medical record will contain a complete detail of all the findings that have resulted from such a post-mortem examinations. Okay. Now we shall move on to the Central Sterile Service Department. Okay. This department supplies all types of sterile items required for nursing units. They include sterile linen, sterile kits, operating theatre packs, needles, syringes, etc. In addition, this department also provides the personnels to clean, inspect, repair, assemble, wrap and sterile by special treatment and prepare the types for various nursing units, operation theatres, etc. This department is under the supervision of a qualified pharmacist. Kindly make a note, the department which is Central Sterile Service Department will be supervised by the qualified pharmacist. Next would be the pharmaceutical services. Although the pharmacy department is one of the many divisions of a hospital, it exerts professional picture and status of the hospital as well as upon the economic of the total operational cost of the institution because of interrelation with and the interdependency of these other services upon it. In the community practice of pharmacy, the pharmacist is aware of the doctor-patient-pharmacist relationship. In this setup, the doctor makes the diagnosis and prescribes a drug to a patient, and the pharmacist dispenses this medication. Isn't it? We all know that. The patient takes the prescribed drug to himself, or at most, it is administered to him under ordinary circumstances by a member of his family. This is not true in the hospital or in an extended area facility. In the hospital setup, we find a professional nurse being added to the doctor, patient, pharmacist trio. So trio, doctor, pharmacist, patient trio, where there is only three persons, doctor, patient, and there is a pharmacist. This is a three patient group trio. making it to a quadlet, because in hospital there is one more person which is a professional, that is nurse. The doctor writes the prescription, the pharmacist dispenses the prescription, and nurses will advise. It is not a method of self-medication, which is not practiced in the hospital settings, isn't it? It is clear now that the pharmacist who practices his profession in an institutional environment must be aware of various forces operating around him, and he must learn not only to understand them, but assist in carrying them towards the ultimate goal of better patient care. Okay. Lastly, the final part of this lecture session is the hospital management, because the hospital management is very important part in anybody, in any institutions, in any colleges. The management part plays a very great role. Okay. So we may therefore consider in the following portion of this session briefly the sources from which income may be derived to meet the operating expenses. Okay. The primary source, as the student will realize, is the charges received from the patient against the hospital bill for the services rendered by the hospital to the patient. The big government-run hospitals such as civil hospitals, primary health centers and dispensaries in rural areas of India are mainly run by the government, whether it may be the state or central government, which is funds against the budget provisions, isn't it? The bills or charges received by the patients are either fully paid by himself in full part payments, or a part of the payment will be made by the third party coverages such as central government health schemes. In some large cities, they have the schemes are available. Okay, like health insurance, ESIC schemes, employees health insurance schemes. Another source of income, especially in teaching hospitals where the research work is undertaken, is derived from overhead charges on the research projects carried out in such hospitals. Income derived from invested endowment funds from yet another source of income. That may be other type of income. Endowment funds. Income derived from other types of investments. Income derived from gifts and contributions towards general functions, functional expenses by friends and well-wishers of the hospitals, such as industries, charitable foundations, and local community fund. All the sources thus contribute towards the income of the hospital against which expenses are incurred. In a well-managed, no-profit hospital, it is income equal the expenses. However, with rising cost of many articles and services, usually the expenses exceed the income, and the hospital has to either release some of its capital assets in order to meet the deficit, or attempt to underwrite it, or raises funds through appeals for charity funds. So I want to conclude this this session by saying this: a running hospital requires a lot of tremendous pressure he has to undergo. The hospital administrator has to undergo tremendous pressure. In many hospitals, the hospital administrators, especially in the abroad scenario, the hospital administrators are the pharmacists. They have to maintain the hospital, they have to look out, they have to pay the doctors over there, they have to take care of patients. That is the prime motto of any hospitals. They should see to it that the hospital should not run in loss, because if hospitals cannot be, if there is no profit, definitely it is not a question of profit, or the business never comes over there, but the hospital has to furnish, means some sort of service has to be rendered to the society, means some income is required to run any organization. Okay, that will be that expenses are incurred from the patients, taken from the patients. Some of the schemes are available for the poor and needy, like HSVN schemes, ESIC schemes, and other schemes, which definitely helps the poor section. Like health insurance schemes are there, which are taken from many agencies. Okay, these schemes provide a valuable guide or something to poor and needy. That time the hospitals have a definitely great help. They are tied up with many organizations, okay, some insurance companies, and they can claim the funds, okay, they can raise the funds over there. Okay, so what we have discussed and what we have tried overall, the summary of the chapter: the hospital is a complex organization or an institute which provides health to all people. Okay, hospitals are focused primarily on providing care. Then we have seen the different classifications of hospital, whether it is the clinical basis of classification, isn't it? And other types of classification, how the hospitals are classified into different categories. Okay, we have seen like the government classification, I mean the ownership classification or control basis of classification, the classification based on different system of medicines, isn't it? And again, we have seen different staff requirements which are required for the hospital to run efficiently. Then we have seen divisions of the hospital. Different divisions are there to run successfully, how different divisions of the hospital work efficiently to manage the patient care. And lastly, we have seen associated medical services, how these associated medical services are very much required to make, to come to the conclusion of diagnosis. And lastly, we have seen and we have tried to understand the management part of the hospital, how it is carried out, and how the revenue comes from, whether it is from pharmacy, whether it is from surgery, whether it is from any part of the things, it is for the welfare of the patient. It's not for the making revenue of the patient. Most of the hospital does that thing, but it's only for welfare of the mankind, to provide patient care. Okay, that completes the whole chapter on hospital and its organization. Thank you. They may be advanced to has residential medical staff.